Hello all, I'm Dr. Adil Moulanchikkal, lead specialist at EliteAyurveda. Today I'll be discussing about what triggers psoriasis. Psoriasis affects men, women and children alike and can occur at any age from infancy to old age, but normally occurs between the ages of 10 and 30. Now there are different areas of concern who get psoriasis. To brief, a few are your genes and your immune system. Little bits of your DNA called the genes are instructions for your cells. They control things like your eyes and the hair color, your taste for certain things and other ways your body works. Some genes are only active at certain times. Now when you get psoriasis, the genes that control your immune system signals to get mixed up. Instead of protecting your body from invaders as it is designed to do, it promotes inflammation and turns skin cells to overdrive. About 10 in every 100 people have genes that make them more likely to get psoriasis, but only 1 or 2 of them are actually able to do this. Now coming to the next one, which is hormone changes. Psoriasis often shows up or flares up during puberty. Menopause can also trigger psoriasis. During pregnancy, your symptoms might be better or even go away. But after the baby is born, then you might also get a flare back. There is a next condition where the psoriasis is more trigger factor, which is alcohol. Heavy drinkers have a high risk, especially in younger men. Alcohol can make treatments even less effective as well. Now coming to smoking. Smoking habits can double your risk of getting psoriasis. Smoking makes it harder to get rid of psoriasis symptoms as well. It's closely linked with the hard to treat type called pustular psoriasis, which affects the palm of your hands and the soles of your feet. We'll come to the stress. Your immune system may respond to emotional and mental pressures the same way it does to physical problems like injuries and infections. Now this is also a major factor for psoriasis as a trigger. Some modern medicine can also make psoriasis worse. For examples like lithium, which treats bipolar disorder and other mental illnesses. Now medicines for high blood pressure and heart. Anti-malarial medicines, which also treat inflammation, can also make a trigger factor for psoriasis. Infections, when we come into like strep infections in particular, are linked with buttate psoriasis, which looks like small red drops. Ear itches, bronchitis, tonsillitis or respiratory infections such as a cold, a flu or a skin problem can also trigger psoriasis in some people. Now we'll come to sunlight. What is sunlight? How it works as a trigger for psoriasis. And natural sunlight is good for most people with psoriasis, but for a few, the sun makes their condition more worse. We'll also see about what skin injuries can make as a trigger for psoriasis, like a cut, scab, bug bite, infection or too much of scratching on the skin also trigger the condition called psoriasis. We'll come to what and how weight can do it. People who are obese tend to get plaques on the skin, creases and folds. Now this is a trigger factor for psoriasis. What about weather? In some people, psoriasis might get worse in the winter or monsoon. Now dry air, less natural sunlight and cold temperature can make symptoms worse. I will explain more on the trigger factors which can make psoriasis or worsen the condition. Keep watching my videos for more information and an update on psoriasis. Thank you.